Hi, it's Tom here from Running Physio. Today I wanted to share with you a really intriguing new study that has suggested that something we may well be able to add to our standard care of patellofemoral pain in runners or runner's knee that may actually lead to better results. Now, this is an interesting study by Bagheri et al., which has just been published, which looked at adding mindfulness to standard care in female runners, a group of 30 female runners with patellofemoral pain syndrome. Now, I'd like to give you a little bit of background around some of these concepts before we talk about the study and the results in that particular study. Now, one of the key concepts and terms they use in this study is catastrophizing. And catastrophization is something that we do need to be aware of in our runners. And one thing I would like to make you aware of is this great tool called the pain catastrophizing scale that you can use to actually assess this. And this is what they did within this study. Now, this scale actually has 3 dimensions, which I think are quite useful for us to be aware of. So one is rumination, the inability to stop thinking about your pain. And that's really quite important because if people are focusing on and thinking about their pain a lot, it is actually quite often going to increase their pain. 2 is magnification, and this tends to refer to this exaggerated appraisal of pain as a threat. So again, it sort of ties into their beliefs around pain and will influence how they experience pain. And the third one is helplessness, this feeling that a patient may have that they're not in control of their symptoms and not actually able to control their pain, which again will increase the threat value. And I think actually quite often we will see with runners that they will have some catastrophization. They may be stuck in rumination, they may have this magnification effect, they may feel helpless to manage it, and we won't always be able to get to that information from them just through a subjective questioning. They may not volunteer it. So using something like the pain catastrophizing scale can be a useful way to appraise that and assess it in a little bit more detail. Now, it's also interesting that actually patients with mental health conditions like anxiety or depression may be more likely to catastrophize and to ruminate and to struggle to control that rumination. That can be a feature of anxiety where we get stuck in negative thoughts, ruminating on them, and unable then to actually pull away from those thoughts and engage in life and valued activity. So if you're working with a runner, obviously make sure you ask them about their mood and mental well-being. And if they are someone that struggles with anxiety or depression, I'd be even more inclined to be exploring the catastrophization side of their sort of pain experience, really. Now, often when you look at research in patellofemoral pain in runners, or runner's knees, we're terming it in this particular video, you see it's very much load focused. It's very biomechanically focused. And that's because we know that running is quite a high load activity for the patellofemoral joint. But we have to recognize too, there is actually evidence of central sensitization in runners with patellofemoral pain. And I'm going to show you a quote from a study that's looked at this. So Panzinato et al. Actually discovered evidence of widespread hyperalgesia in runners with patellofemoral pain. And they concluded in their study that greater running volume may lead to poorer self-reported knee function and hyperalgesia in runners with patellofemoral pain. So actually, there is evidence of perhaps some central sensitization, some hyperalgesia, and it links to training volume as well. So the more I work with runners, the more I work with people, the more I see that a lot of these things are really interwoven together. They don't exist as things in their own right, but these central changes are going to be linked to how much we train. So obviously managing training load is going to be important. So let's talk a little bit more about this recent study then. So it was a small randomized control trial in female runners with chronic patellofemoral pain, so 30 altogether. And they were randomized then into one of 2 different treatment groups. Now, both groups got exercise-based therapy, very much in line with current research, with a collection of different exercises involving strengthening and stretching, as well as advice around managing their training load and some suggestions on their running gait. In addition to this, one group also received 8 weeks of mindfulness-based therapy, which is often designed to help people to sit with their experience, to sit in the present moment without judgment, without fear. And there is some thought from some of the earlier research in this, right, dating back to the 80s, that being able to sit with your pain to some degree without adding fear, without adding judgment, without adding the extra layers of distress can actually be quite useful. So they added in this 8-week program of mindfulness-based training, and the results, I think, are really intriguing. Now, I'm going to show you a quote from the study to highlight this. Now, Bagheera et al. Concluded that adding an 8-week mindfulness intervention to exercise therapy led to decreased pain intensity, fear of re-injury, and pain catastrophizing, and increased knee function and coping to manage knee pain in recreational runners with patellofemoral pain. So really quite a lot of positive results and significant differences above just exercise-based therapy alone. And actually the runners that completed the mindfulness-based training had less pain when running. I mean, this is great. This is what we want for our runners. If we can get a better outcome by adding something like this in. Now, obviously, there are limitations to this study. It's just in female runners. It's a relatively small study of just 30 people altogether. Also, when you delve into the interventions, you can see they're multimodal. There's a lot going on there. So you've got multiple exercises. You've got advice around training and load management. You've got potential gait retraining advice. You've got mindfulness as well. So I think we need to see this replicated, and I'd like to see a larger study of this. But it's certainly got some intriguing findings, and maybe should lean us towards a bit more thinking about these things, these more kind of psychosocial based treatments perhaps for runners with patellofemoral pain. Okay, some take-home thoughts for you here then from this research. Number one, I think we do need to make sure we're asking our runners about their mood and mental well-being, particularly as we can see runners with patellofemoral pain, because it's going to influence how they approach their pain and their rehab. So be prepared to ask people about that. Number two, I think we should consider catastrophization as part of the picture in runners with patellofemoral pain and use something like the pain catastrophizing scale to assess that. Number three, I think we do need to recognize obviously that training load management is key and may actually influence things like hyperalgesia. And there is evidence in runners that simply educating them around training load management can help pain and function in runners with patellofemoral pain. But also crucially, it may well help some of the aspects of catastrophization if we're able to put the runner back in control of their pain. They may feel less helpless if they know that modifying their training load can help to reduce that sensitivity and pain, then actually hopefully we can put that back in control. And then number four, I would consider something like a mindfulness intervention for runners with patellofemoral pain, particularly if they're showing high levels of catastrophization, they're ruminating a lot about their pain, or perhaps they have some coexisting anxiety or depression. And don't be afraid to team up with a sports psychologist or counsellor to get this delivered in the best possible way for a runner. It won't necessarily be down to us as therapists to do that. I think we should look to work with other people in an integrated team to get the best results for runners. Okay, thank you very much for listening to this short video today. I've put a link to our different webinars. We've got lots of different webinars now on running injuries. One's on iliotibial band syndrome, Achilles pain, lower back pain, lateral hip pain, whole collection of them for you there. So delve into those, they're all free. Have a watch of those and you can learn loads more about the management of running injury. Okay, thanks again for listening. See you again next time.